I'm Dr. Erica Reese. I'm a second-year resident in obstetrics and gynecology at the University of Kansas Medical Center. I'm here to give you a brief introduction to our daily routines so you can know what to expect from a residency here at KUMC. So in terms of our gynecology service, these are for patients who have any surgical reasons for benign gynecology regions. In addition, we're also responsible for any of the benign consults that come in. When this happens, we go and see them and then we staff them with our GYN rounder. The GYN rounder is the same for the entire week, which really makes continuity on the service great because you have the same attending to staff things out with as you move through. The way that our normal day looks like is you come in the morning and you get sign out from the night team and then you round in all of your post-operative patients or any patients that have been admitted to the gynecology service. After that, you round with your attending and then you're off to your surgeries. During the day, you're managing any new consults that come in and taking care of your patients pre-op, post-operatively, and the rest of the service, and then you sign out between 5 and 5:30 with the night team. Something that I loved about my GYN rotation was the amount of time that I got in the OR even as an intern, and the ability to see my surgical skills grow so quickly and to have that constant feedback from my attendings. And you really learn how to manage the service when you're on this rotation. In terms of our obstetrical rotation, the layout of our OB floor is an OB workroom, which is a central location for all of us. Additionally, you have your triage. We have 4 triage rooms. Connected to that unit is our mom-baby unit. All of this is on the same floor. So we have our obstetrical unit, our postpartum unit, and our NICU all connected, which is great for both providers and our patients who have any babies in the NICU. In terms of your schedule, when you come for your OB shift, you have board sign out at 7 a.m. So you come and you round on all of your postpartum patients that were there the night before, have your notes done and sit down for board at 7 from the night team, and then you work your shift, and that includes anything from checking in inductions and getting their labor starting, managing patients who have already been laboring, having your scheduled C-sections and your unscheduled C-sections, and then any triages that come throughout the day, as well as any postpartum complaints as they arise. You start to wrap things up around 5 and sit down for a board sign out with our night team at 5:30. Obstetrics is so much fun. I love having the complete variability that every single day has. When you walk out at the end of the day, you can't believe that that's what your day was, and it's truly the best job. Nights usually go pretty quickly. There's a lot to get done and a lot of services to cover, but it's a really formative time and you learn a ton about your abilities, and it's always a good bonding experience with whoever you are on nights. In terms of the night shift responsibilities, there are always 2 residents who cover nights. One is a junior resident and one will be a senior resident. The junior resident is responsible for covering low-risk labor and delivery and benign gynecology. The senior resident is responsible for covering high-risk inpatient and gyn-onc. Your night shift starts at 5:30. That's when board sign-out is from the day team. So you come, usually with your coffee, and you sit down for board, and then you receive your respective sign-out from those services. So the junior will receive sign-out from the gyn team, and the senior will receive sign-out from high-risk inpatient and gyn-onc. After board, then you go off and you start your shift. So again, the junior resident will go and manage the laboring floor. We don't have any scheduled C-sections, but of course there are always unscheduled C-sections, so we help take care of those as well. And then triages as they come through, any postpartum issues that may arise in gynecology consults, mainly as they come through the ED. In terms of the senior responsibilities on nights, they're responsible for the gyn-onc service and the high-risk inpatient. So these patients are quite sick and usually they are dealing with transfers or consults as they come through and managing the services respectively. As you move through your night shift, you start to wrap things up around 6:30, round on a couple postpartum patients. The teams get everything ready for handoff in the morning, and then you sit down at 7 for board and sign out to your respective teams. So one thing about nights is because there is so much responsibility and because you are covering so many more services, it's not one of your first rotations. So the program makes sure that you're ready to handle night shift before you're started, and then you really get to see your skills grow. It's very busy, it's a lot of services to cover, but it can be a lot of fun. Something great about KU is the variety of patients that we see. Being a tertiary care center, we get referrals from all over the states. So the ability to see and work with and learn from a different array of patients every single day only improves your skill and your ability to care for every patient that you encounter when you leave residency. So our tour would not be complete without a little bit information of the day in the life outside the hospital, which does happen occasionally. and just sitting and relaxing and enjoying the beautiful sunsets and baseball that Kansas had to offer. There's also so many different areas and fun places around. We love spending time together with each other outside the hospital when possible. And having that type of bond with people who understand it's okay if you fall asleep at the table because you're on nights, or it's okay if you can only come for an hour but you want to go and see and just have that relief is such a joy, and I'm so lucky to be a part of a program like that. Once again, I'm Dr. Erica Reese, and thank you for joining us on A Day in the Life.